Did you know some medications, seemingly harmless, could be silently weakening the hearts of older adults every single day? I'm a heart surgeon with over 30 years of experience. I've seen hundreds of patients over 60 walk into my clinic complaining of fatigue, shortness of breath, or mild chest pain, and no one ever suspects these are early signs of heart failure. Upon further testing, many of them didn't have high cholesterol, weren't overweight, and never smoked. But they had one thing in common. They were taking certain common medications, some of them for 10, even 20 years. Here's the problem. Certain medications can cause irregular heartbeat, raise blood pressure, or lead to fluid retention, all of which force the heart to work harder. And at some point, the heart simply can't keep up. You may not feel a dramatic heart attack. You may just notice shortness of breath, light dizziness, or getting tired more easily when walking. These are the early signs, your heart's quiet whisper before it screams. This video will reveal 7 common medications silently weakening senior hearts without you even realizing it. If you or your parents are currently taking any of these, you need to watch till the end. Don't wait until the heart speaks through a real heart attack. By then, it may be too late.
Most seniors don't die from sudden accidents. They die slowly from things they didn't even know were harming them. Every week, I meet patients who believe their fatigue is just aging. They think waking up tired, climbing stairs with shortness of breath, or taking longer naps is normal after 65. But that's not true. The real reason may be hidden deep inside. Your heart is working harder than it should, and you're ignoring the signs. Many of these patients are taking medications prescribed years ago, never reevaluated. They take them because a doctor once said it would help blood sugar or prevent stroke. But over time, their heart begins to struggle. Here's the hidden danger. Some medications can damage heart muscle cells, reduce the heart's ability to pump, or disrupt your electrolyte balance, which leads to arrhythmia, a silent trigger for heart failure. Worse, these effects don't show up overnight. It may take months, even years, for your heart to begin showing signs of distress. By the time a cardiologist sees the problem, it might already be too advanced. That's why this video is so important. We're not here to scare you. We're here to protect you and your loved ones from the medications that quietly weaken the very organ keeping you alive. It's not too late to act if you know what to look for. Let's explore the 7 common drugs and how they affect your heart starting now.
Let's start with the 7 everyday medications that may quietly harm your heart. These drugs are not illegal. In fact, they're often prescribed by well-meaning doctors for conditions like diabetes, depression, or even pain. But the long-term effects on your heart are rarely discussed. 1. NSAIDs, non-steroidal anti-inflammatory drugs. Used for arthritis, headaches, or body pain. But drugs like ibuprofen and naproxen can raise blood pressure, cause fluid retention, and strain the heart. 2. Calcium channel blockers, prescribed for high blood pressure or angina. However, in some seniors, they can lead to swelling, slow heart rate, or even heart failure symptoms like fatigue and shortness of breath. 3. Diabetes medications, especially thiazolidinediones. Drugs like pioglitazone may help lower blood sugar, but studies show they can cause fluid retention leading to congestive heart failure, especially in older adults. 4. Certain chemotherapy agents. Drugs used for cancer, like anthracyclines, are known to be toxic to heart muscle cells. Even years after treatment, patients may develop weakened heart function. 5. Stimulants, including some ADHD medications. These increase heart rate and blood pressure, and in older adults may raise the risk of arrhythmia or heart attack. 6. Decongestants like pseudoephedrine, Found in many cold medicines, these can constrict blood vessels and spike blood pressure, triggering chest pain or irregular heartbeat. 7. Some antidepressants, especially tricyclics, may interfere with electrical signals in the heart, increasing the risk of palpitations, arrhythmias, and even sudden cardiac events. Important note: never stop these medications without consulting your doctor. But if you or a loved one is taking any of these, it's time for a heart-safe review.
So what should you do now if you're already taking one or more of these medications? First of all, don't panic, and never stop a prescription on your own. Suddenly stopping some drugs, especially heart or blood pressure medications, can be dangerous. Step 1. Make a heart-safe medication list. Write down every medication you take, even over-the-counter drugs, supplements, and herbs. Then highlight the ones on today's list. Bring this list to your next doctor's appointment. Step 2. Ask your doctor the right questions. Don't just ask, "Is this safe?" Instead, ask, "Has this drug ever been linked to heart failure symptoms in people over 60? Are there alternative medications with lower cardiovascular risk? Should I get a heart checkup to monitor the effects?" Doctors may not always raise these concerns, but when patients ask directly, it opens the door for smarter, safer decisions. Step 3. Track your body's signals. Notice any recent changes? Feeling more tired than usual, gaining weight or swelling in the legs, getting out of breath, doing things that used to be easy. These may not be just aging. They could be early signs of heart damage. If you're unsure, ask for an echocardiogram or BNP test. These tests can detect heart strain before a crisis hits. Remember, it's not about fear. It's about being informed. You have more power than you think to protect your heart.
This isn't just a medical issue. It's a national problem, hidden in millions of American households. Most of these heart-damaging pills are prescribed for everyday conditions: insomnia, allergies, high cholesterol, depression, acid reflux. And doctors often don't connect the dots between these pills and a weakened heart. Why? Because side effects don't always show up right away. Some drugs act like a slow leak in a tire, wearing down your heart over months or years. One study from the University of Illinois found that older adults who take certain anticholinergic medications have a 34% higher risk of heart failure, even when their blood pressure is normal. And many of these medications are still sold over the counter without warning labels. Here's what makes it worse. Seniors often take multiple medications at once, a problem known as polypharmacy. Each drug may seem harmless, but together they can create a toxic cocktail for your heart. Even more alarming, most families never suspect the pills are to blame. They notice mom's getting weaker or dad's more tired after walking. They chalk it up to age. But the real culprit might be sitting in the bathroom cabinet. That's why awareness is the most powerful tool. Check your medications, ask questions, listen to your body, because the danger is often silent until it becomes a crisis.